Teaching Hospital in Bauchi received a sum of 1,078,774,400.32 naira as a COVID fund. The Chief Medical Director is here to speak to their presentation. We have copies of the presentation which I said they should project, apart from sharing the few copies that we have. I said they should also do a projection on the board of the soft copy so that we can follow. Now, your presentation should just touch on the key issues before we go into the engagement with honorable members. You're welcome.
A challenging period to us because at that time, a lot of things are not in place to take care of the patient that come to the hospital for isolation, for diagnosis, and also for the treatment. We lack laboratory where we can do the investigations to confirm the disease. We lack isolation center where we can keep the patient there. And we also lack the PPEs that we use in the management of these patients. However, we thank to the federal government at that time when the intervention came, and we are able to procure a lot of equipments for the management of these patients, and also establish a molecular laboratory for the diagnosis, as well as the isolation center where we manage the patients. Mr. Chairman, we received a total of 949,233,268 naira 80 kobo. And this money came in 233 949 233 268 80 kobo.
Summary sheet of appearance, please.
233 268 80 kobo. That's the total amount. And this amount was released in 2020 and 2021. In 2020, we received a total of 453 337 788 13 kobo. And in 2021, we received 495 895 480 67 kobo, making the total I mentioned earlier. This amount were implemented in these four major areas. Number one, 10-bedded ICU with all the complement of ICU management, including the bed, the monitors, and ventilators, and oxygen piping, and the delivery of other items needed for taking care of intensive care patients. And for that project, a total of 353 590 750 were expended. The second item that was used for that by that amount is isolation center, whereby we upgraded our isolation center with beds, all the necessary equipment needed in the management of patients in isolation. And that one we expended 99 957 992 32 kobo. And also we procure PPEs, that is personnel PPEs, personal preventive equipment, and in 2 trenches, totaling about 149,622,915. And also we established a molecular laboratory with all the equipment needed for the diagnosis and confirmation of infectious disease, not necessarily only COVID-19 at that time. Because at that time we consider that other infectious disease may come in, so we take care of that time in the laboratory. And we spent 342 363 774 15 kobo. These are total amounts expended in those 4 areas. Mr. Chairman, sir, this amount that was spent.
Are you taking that from this document?
Yes, sir. Yes.
Okay, but you're taking a summary of it.
Yes, it's a summary of what I have.
Okay,
here.
because
yes.
if you do that, it will also be good for you to reference the page.
Yes.
And the number of the item, like the last item you just mentioned now, which particular project did you mention last?
Molecular lab.
There?
Molecular laboratory.
Molecular laboratory.
Yes.
That was 353 million. What was it?
ICU, 10-bedded ICU. Yes,
That is equipping of the 10-bedded intensive care unit.
yes.
Care unit.
Yes, sir.
The second was isolation center.
Yeah, isolation center, the second one. Third one is PPEs. Yes, and then the fourth one is molecular laboratory. So this page, the
Page
template.
2. It's on page 2 of that document.
Page 2 to
Now,
3.
Madam Secretariat, do you have the soft copy of this presentation? Why no? Why is the soft copy, clerk?
These are the breakdown of the money that we received in 4 different projects. And currently, Mr. Chairman, all the 3 projects.
Is it 4 or 5?
4, Mr. Chairman. The PPEs are in 2 trenches, so we are combining it to be PPEs. They're all PPE.
Yeah, but they are essentially 2 different. That you mean item 4 and 5?
Yes.
You listed them as 4 and 5 on
4
this.
and 5, yes, sir. Yes.
Yeah, just say they are 5 then.
Okay, 5. Page 3.
3.
In page 3. Yes. 4 and 5 are lumped together because they are the same item.
Yeah.
That's what is was
3 and
also
5,
summary.
but they are 5.
Yes. They are in page
Because
3,
they are
sir.
even awarded to different contractors. So let's treat them as 5. Yes,
So,
please.
Number 3 and 5 were matched together to be PPEs on, but they are total of 5 trenches, as I mentioned earlier. So, Mr. Chairman, sir, the money that has spent, actually, I can say it has yielded the needed result, because initially, before the COVID-19, we don't have molecular lab. And Bauchi State is one of the areas that we have a lot of cases of Lassa fever. Then we have to send our patient for treatment to Irua, about 1,000 kilometers from Bauchi. But with the emergence of this lab, we are able now to do, apart from COVID-19, we are now continue using the laboratory for the management and the diagnosis of Lassa fever. In the whole of Northeast, sir, as of now, is the only laboratory that are using this molecular lab that we are able to establish to diagnose Lassa fever and manage. And I can say that the number of cases that we are seeing are increasing because other states in the region send their patients for diagnosis and management. And also, currently we are having another incidence of diphtheria. Mr. Chairman, you are aware many people, children are dying before diphtheria. And the reason is that sometimes the management and also the diagnosis are a bit difficult in some areas. So the presence of our isolation center and the personnel we have during the COVID-19, we are able to, engage our staff for a lot of training and then use of PPEs to get prevention. As such, we are now currently also managing diphtheria from other states that are coming to us, and we isolate them and manage them.
Thank you, CMD. Because of time, we know that Bauchi is very far. That is the summary of the presentation. But before we go into the question and answer session, I just want to ask the Office of the Accountant General why you claim that 1,078.7 million naira was released to this teaching hospital, whereas they claim that you released only 949 million naira to them. So what happens to the difference?
Mr. Chairman, sir, with all sincerity, there are certain, Honorable Chairman, sir, there are certain explanations we might not be able to give immediately. So when we get back to the office tomorrow, we'll come.
Accountant General. Accountant General. Okay, I think the man to your right wants to help you, Abi. I need help you.
Honorable Chairman, sir. Yes, the letter that was sent to us, dated 22nd, the attachment was not there. We're only given the copy, which we have notified.
The letter that was sent to you by?
Yes, from your office here, from the secretariat, sir.
From the PAC?
Yes, sir. The schedule was not attached.
Which schedule?
The schedule of the agencies that will be available today, sir, was not attached. And then 2 weeks ago, sir, the fund section, which is in charge of the releases, were asked to come, but when it was postponed, they were not informed, sir. They are supposed to be here because this figure originated from the funds department, sir.
Accountant General, you are not prepared for this hearing, and that's so unfortunate.
Sir.
Excuse me, please. And it shows that you are really taking this assignment with carelessness, because the foundational document we are working with here is your document, and you are aware of the issues that will be coming up here. So if an agency said you gave them a certain sum of money, and you said you gave, you claim to have given them 1 billion, and we're looking for about 120 billion naira. 112 billion naira is what we have. 120 million. Okay, 120 million naira, and then you claim that you are not aware of the schedule of appearance. You don't need to have any schedule of appearance. Yours is to come with the complete document on the funds released to all MDAs on COVID-19. Any agency can go. If an agency is supposed to appear on Friday and they ask us to please grant them audience for today, we can bring them in. And your office is too central to this investigation to be going this way. So please, beginning from tomorrow, we don't want any excuses. If it is the funds, if you are not the right personnel to attend to this issue, please advise Madam Accountant General to get the people to have the information on their fingertips to come and represent her in this public hearing. Very, very, very important, please. Honorable colleagues, please, questions? Accountant General, that is noted. Thank you. Yes,
Thank you, Mr. Chairman, for reiterating that, because the Accountant General's office should know how important they are to this investigation. Please, this is a very serious matter. If you look around you here, Nigeria is represented. The Nigerian people are represented. We are not here to play. So, Mr. Chairman, the first question I would love to ask is whether to the Accountant General's office.
I'm really sorry to interrupt you, please. Yes. There's a procedural error that
and we have the contract sum. And if you go to your right, you will find total payment made to the contractors. And everything on the extreme right says completed. If you go to the one you have the numbers here, 39 million. If you go to the total payment made to contractors is 22 million. And you say completed. You go down a little bit to equipping of isolation center. There is another 42 million, but 17 million was disbursed to the contractor. Please, and you said completed. Can we reconcile these numbers, please? There is a disbursement of award sum of 195 million, but 146 was disbursed, and you said completed. Please reconcile those three numbers for us. Thank you, Mr. Chairman.
During the COVID-19 period, some of the items and the equipment, especially PPPs and other equipment, were not delivered at the same time. The contract was given, but the contractor was not able to get the items at the same time. So what you do is, when you request for his payment, you look at what he delivered, and you reconcile with the amount that is supposed to be paid for him, and then we pay that one. That's what actually we are saying completed for that particular item with the list. That's the explanation, sir, Mr. Chairman.
Okay, yes.
So what they deliver was what you paid for?
Yes. Then later, when they bring the remaining, we pay them.
And when you pay them later, where is that money? It's not showing here.
No, that's why they are seeing the difference.
Because you wrote completed. What was appropriated is different from what was disbursed, but you wrote completed.
No, what I'm saying,
what we actually paid was the items we delivered. During that time, some of the items were not actually delivered. And so we couldn't have paid what was not delivered. So we cut off the payment and paid according to their invoices. And the item that was actually supplied at the store level.
So did you refund the money back?
No, sir. If you look at the quantum, the total amount spent, we spent about 900, we still have a balance of about 3 point something million. Even if the cumulative total paid was actually 940, about 945 million, 100,000. We still have a balance of 3 point something million in our account as I speak.
Sorry, can I ask, sorry, quick question. Your expenditure, is it based on the completed or the money paid or the contract awarded?
It's based on the amount of the quantity of items supplied.
No, what my question is, you have two figures here. One is the contract awarded.
The contract was 40, in this case 47 million.
No, I'm talking about the columns here now. I'm talking about there are two columns here concerning money. The contract was awarded, say, for 195 million, right?
Page 3.
Yeah. Yes, page 3, and you paid 146 million,
Okay.
right?
Yes, sir.
So the question is,
Yeah.
are you following, sir?
Yes, sir.
So the question is, where do you have your total expenditure? Is it this one, or the one before the completed, or the based on the award letter you have issued out?
No, it's the last one, sir.
Okay, thank you very much.
So your payment is 146.9
Total.
Huh?
Yes, sir.
on that head.
Yes, sir.
Okay, but you awarded a contract of 195 million naira.
If we had to do that, there must have been reasons.
No,
especially-
just a moment now. No, just affirm, just answer it.
Yeah.
The contract awarded was for 195 million naira,
Yes, sir.
but the amount paid was 146 million naira,
Yes, sir.
and it's completed.
Yes, sir.
Okay, so that leaves you with the balance of how much?
100, the difference between 195 and 146. But the point I'm trying to make, sir, if this contract must have either been reviewed or that because we paid based on the quantities of items and the quantum of items they supplied to us.
Ask.
Because there are documents that have actually been for a while. And perhaps if we need to make proper explanation, that we need to make reference.
Okay, sorry, I want to ask a
Right.
question
Yes, sir.
on health procurement. How many percent? What percentage the tax, VAT, and everything? How many percent does it come to?
We are in a hospital. Most of the items are VAT. They are not VATable.
Eh?
Pay 7.5%.
Thank you very much. So in total, so no tax, no tax.
No, there are evidences of tax, even within this.
So why I want to know so that we can minus based on this and then find out the figure after we minus the 146 million, so that we know what we are looking for. That's because if we know.
Okay, yeah, actually, because this actually includes the tax component.
It's already included.
And this is the net payment.
Sorry, sir, for us to know what we're looking for here.
Okay.
Just one single one. This was 195 against 146.
Okay.
Can you minus and then as an accountant minus and give us a figure? So we know what we're looking for. What? No, the total.
So it's
Let's
the
minus.
difference. The difference.
That's if we
Okay.
minus it.
Okay,
Okay, please let me quickly finish my session.
okay, you can just do that quickly so that we
okay.
can move on to that.
Okay, sir, why I'm asking you this is when you award a contract,
Yes, sir.
what you actually give out, if there's a difference, when you add it together, it should equal the amount you awarded, right?
Yes.
Okay, but this house has been told now that there's some balance somewhere. So you owe us that explanation. Then my next question will be, I know the CMD talked about some equipments that were procured. And you started talking about Lassa fever, diphtheria. I'm not a medical doctor. But my question here would be, the money that was released, was it for COVID intervention or for Lassa fever or diphtheria?
Thank you, Mr. Chairman.
You can put up your own microphone, accountant.
Thank you, Mr. Chairman. What I was trying to explain was that the equipment that we bought is for the use in the laboratory molecular lab. Molecular medicine or molecular biology can be applied to other
Like having
diseases. Multiple diseases. There are other diseases that can be used. And what I'm saying is that it's an advantage for the nation to have this kind of lab, especially in our own region where we have Lassa fever. The same equipment that we use for COVID-19, during COVID-19, we are still using the equipment for Lassa, of which before then we have to send them to Irua for their diagnosis. So I'm just trying to emphasize that.
All right.
Yes.
Yeah, that's what. Honorable Bapa Misao.